Hi, everyone. Okay. Dato Hazima Zainuddin of Women Leadership Foundation, Dato Dr. Saunthari Somasundaram, President of National Cancer Society Malaysia, Dr. Azlina Firzah Abdul Aziz, Consultant Breast Surgeon at Pantai Hospital, Kuala Lumpur and Park City Medical Centre, Elaine Daly, our beloved moderator, Puan Ruzi Ajit, Chief Executive Officer of CGS CIMB Securities, my boss, and ladies and gentlemen. Thank you so much for joining us today at the CGS CIMB Thought Leadership Series. Today, instead of spreading financial literacy, we will be spreading a different kind of awareness, breast cancer awareness. And we're honored to have with us today Dr. Azlina Firzah and also Dato Dr. Saunthari, who will be shedding some lights into the topic. The conversation will be moderated by Elaine. But before that, our session today will start with an opening speech by Puan Ruzi, then followed by the conversation and a closing remark by Dato Hazima. And if you have any questions, feel free to drop them on the chat box here, and Elaine will probably pick it up and ask it. And of course, if you are catching us on Facebook, drop the questions here and we'll do the necessary. So without further delay, let me pass the stage over to Ruzi. Over to you, Ruzi.
Thank you, Chime. Good afternoon, ladies and gentlemen. It is my pleasure to welcome you to our 10th CGS CIMB Thought Leadership Series. Thoughts is a special social impact platform for prominent individuals to share their wealth of experience to inspire young, up-and-coming talent within the industry and to create and spread a different kind of awareness in conjunction with Pinktober. We are honored to have Women Leadership Foundation, also known as WLF, as a partner for this special edition. And I would like to give a special mention and welcome to Yang Bahagia Dato Hamizah Zainuddin, Deputy Chairman of WLF, for collaborating with us in the spirit of Pinktober. In today's world, cancer has major impact on so many people and families in Malaysia and across the world. Many of us personally know someone affected by cancer, whether we witness the fight of a loved one directly or we see the worry of their families and friends. This session marks Breast Cancer Awareness Month, where at CGS CIMB, we recognize those struggling with the disease and the family and friends who support them. Awareness surrounding breast cancer is incredibly important as early detection, often through screening, can catch the disease when it is most treatable. To show our support in promoting Pinktober, CGS CIMB will be lending our support to Pantai Hospital Kuala Lumpur fundraising this year for breast cancer patients. The funds are to assist survivors to buy mastectomy bras with prosthesis. Pantai Hospital is also offering subsidy breast ultrasound and mammogram packages from September to December 2021. In addition to that, the National Cancer Society Malaysia will be having a limited time offer for free mammogram screening for Malaysian women aged 40 and above. CGS CIMB will be offering 1 month zero buy brokerage and CDS free waiver when you open a trading account with us. Remember to enter the campaign code PING to enjoy these promotions. Our distinguished guests today are leading women in healthcare who have carved their names in surgical fields, Dr. Azlina Firzah and Dato Dr. Saunthari. Both doctors have had a long and established relationship with prevention and treatment of cancer, combined with personal experience in cancer support. We also like to introduce our moderator, Elaine Daly, founder of Lead Up Asia, who will assist in navigating the discussion to touch on Malaysians' perception about breast cancer and the transitional journey from detection to recovery. With the collective knowledge and experience in the room, I hope this session will shine a light on the fears and uncertainties that can be replaced with answers and hope. Without further ado, I will pass the floor to our distinguished guest. Over to you, Elaine.
Thank you very much, Ruzi. Thank you very much, CGS CIMB Thoughts, for having me again. The last time I was with you was with Deborah Henry, and we were talking about sustainability when it comes to refugees and stuff like that. But now we're spreading a different kind of awareness breast cancer awareness in conjunction with Pink October month. So we've got with us Dr. Azlina, who is a consultant breast surgeon at Pantai Hospital and Park City Medical Center, one of only 40 breast and endocrine surgeons in Malaysia. Dr. Azlina never chose an easy path. She's also a member and council member of numerous organizations, including Malaysian Oncological Society and Hospice Malaysia and the Breast Chapter. Dr. Saunthari, with over 20 years of experience in cancer control, she's a strong advocate for the awareness, prevention, and early detection and survivorship of cancer. Dr. Saunthari is currently serving as the Medical Director of National Cancer Society of Malaysia, the nation's first not-for-profit cancer organization in its education, care, and support programs. She's also on the board of the Secretary of the Malaysian Women's Action Tobacco Control and Health and the Malaysian Council for Tobacco Control. And a very warm welcome as well to Dato Hazimah. Hello, doctors. How are you? Hello, Dato. How are you?
Fine, thank you, Elaine.
All good.
Fantastic. So, I mean, I'm sure you get these questions all the time, every year, especially during Pink October month. You know, when we talk about breast cancer awareness. Now, what I'm really curious about is the awareness enough? I mean, are people still not aware of, you know, early detection and breast cancer? Dr. Saunthari, you shaking your head vigorously. Maybe you'd like to answer that first.
Yeah, I mean, Pink October in itself has, you know, started in 1985, and the pink aspect of it came up in 1992 with the pink ribbons. So if you're looking at it, you know, for 30 years now, we've been trying to push this message about breast cancer and awareness about breast cancer. And I think everyone knows something about breast cancer,
yeah,
but whether that something is enough to make a difference, I still think we're not there yet. Because a lot of people just feel that, yes, you know, breast cancer is out there and it's common, but it's not going to happen to me. And so I just need to know something just generally, you know, so I can help someone else, but it's not going to happen to me, so I don't need it for myself. And I think that's the wrong way to look at breast cancer.
Okay. So what is the right way to look at it then?
I think, you know, the right way to look at it is that what is the number one risk of getting breast cancer? The number one risk is being a woman. That's it. It's not what you eat. It's not what you drink. It's not your body weight. I mean, all those things have a factor in it. Agreed. But the number one thing is being a woman. So if you're a woman, you can't change that, you know.
Absolutely.
So, you know, because of that, you have to learn about breast cancer. You can't run away from it. You can't hide and say, oh, you know, I don't have family history. No, I'm of the best body weight possible. I'm active. I eat properly, all those things. So I'm not going to get breast cancer. That's not true. Okay, we still don't understand everything there is to know about breast cancer and why some women will get breast cancer and some women don't. But the one thing we know is that if you're a woman, you're at risk.
Dr. Azlina, what's your take on that? I mean, do you think, I mean, you know, you deal with patients every day, you know, talking about breast cancer. Do you think there's enough awareness that's going on, and how can we menambahkan this awareness, you know, so that more people can learn about it and understand more about it?
I have to agree with Dr. Saunthari that the primary risk factor is being a woman. And I have to agree as well that there's not enough awareness going on, because I still see patients with larger cancers. They have spread, and if they had discovered it at an earlier stage when it was smaller, they did not present themselves early enough to the healthcare provider for further opinion. There are lots of myths and misconceptions, and yes, they do say very first thing, but you know, I don't have any family history. Then I have to break that bubble and tell them majority of women with breast cancer do not have a family history.
Right.
So only about at the most 10-15% of women have a family member with breast cancer. And if you investigate that low number, you'll find that much lesser carry the genetic risk. So we have to make every woman aware, and we've been doing this for yonks, for years. And I've even gone to speak to secondary school girls, and that's where we need to discuss about it. But whenever we talk about breast problems, there's always that a little bit of setback. Oh, you shouldn't speak to the younger girls, they'll be scared, or don't show gory pictures. Yeah, don't show gory pictures, you're gonna scare all of them. But I said, no, this is part of being a woman. You need to understand your body. You need to realize when there are changes, you need to seek attention, because even at the most minor, it can be a clue, the red flag that brings you to get attention. And as for many things, if we catch it early, there's so many options of treatment. But when they come late, and this is when most of them say, oh, I was too scared to go for tests, and people say you will lose your breast. It'll get chopped up. I have a flat chest, and my relationship will suffer, my marriage will suffer. All that comes in. So this is still that stigma of coming to check, and I have, to this day, I still have patients when I sign medical certs for them, when they come for a whole day for checks and all that, and when I ask them, do you need a time slip or leave? Doctor, can you please not use your breast surgeon stamp? I say, why? Oh. I don't want my HR or my boss to know that I've gone to see a breast surgeon, because people talk. So I have to go looking around for my old stamps which says general surgeon. Then she says, no, I don't want them to know I've gone to see a surgeon. What do you want? Just that, you see you're a doctor, that's all. Oh my God. So to that extent, that's what I see every day. So we still need to do more. We need to talk about it. Yes.
Yeah,
weird, isn't it?
It's crazy. It's crazy to know that, I mean, Dr. Saunthari said since 1985, you've been advocating for this. I think October's been going on since that time. And people are still so malu about it, Why do you think that's the Malaysian perception?
I think there's still a very old perception when it comes to breast cancer. That it's the family history aspect of it. So if there's the family history aspect of it, if you're an older woman and you come with breast cancer, that repercussion, that cascades down to the rest of the family. So the children. So if someone knows that, oh, your mother has had breast cancer, what is your risk of developing breast cancer? Does that make you a marriageable person?
Okay.
Or not, so all those stigmas are still there. Is that going to cascade down to, to the next generation, etc.? But as Dr. Azlina said, breast cancer in terms of genetic risk is less than 10%. The rest of it is being a woman, combined with other risk factors. Yes, there are other risk factors which are associated with breast cancer, and we're looking at a lot more environmental risk factors when you talk about diet, the trifecta of eating too much fatty food, or being obese, having not enough exercise, etc. All that is there. But the number one thing is being a woman, and because in Malaysia we're not allowed to express our femininity or talk about our femininity or being a woman from a young age, it's not something that people discuss at a young age. Yes, they'll discuss it when they're at menopause sort of thing. It's okay, I'm retired, or I'm menopause. Now's the time I'm supposed to look after my health. What should I do? That's generally when people start thinking about their breast health, when they should be looking at their breast health when they're in their 20s. Because if you look at the number of women getting breast cancer at a younger age Malaysia's rate is about 16% who get it before the age of 40. And that is very different from Western countries, where Western countries only about 6 to 7% get it before the age of 40. So in Asia and in Malaysia, we get it at a younger age. And that's when we should be starting to talk about breast cancer. That's when we should be open enough to discuss breast health. And we're not doing it yet because of that stigma about, oh, you can't talk about women's issues to younger people or unmarried people. And that's another thing which gets to me, is that you can only talk about women's issues once you're married. So we have to break that. We have to break that cycle.
And why do you think it hasn't been broken after all these years?
Because we don't have enough education in school, straight out.
Like what
we don't talk about health.
Like what Dr. Azlina was saying, she said she's gone to the schools and they say that it's too gory to talk about and too shameful to talk about it. But I'm sure in this, I don't know. I mean, as a layperson, I'm sure in this day and age, people would already be okay with that, no? Or am I wrong?
I think okay. Here I think people are quite okay to learning about it, but whether the higher ups or our I wouldn't say government, but our leadership within the country, whether it be in the advertising field or the media field, and et cetera, are allowing us to speak about it in a frank manner. I can still remember going onto TV talking about breast cancer, but I couldn't show any images about breast cancer.
Exactly.
I couldn't show images, or I couldn't even show that, oh, this is how you do a breast examination on myself. With fully clothed, because that wasn't proper. So
you need to use a model to choose. Put a model there. You can't do it. You can't show how you do it. You must use a model.
Oh, because you're showing a boob.
Yeah.
Right. Okay, got it. Now that we know that you're supposed to start checking and knowing all of this in your early 20s, do you think that more people now are being a little bit more aware of it? And how, if it happens to anyone in their 20s, how should they get ready for something like this?
I'll leave it to Azlina.
Azlina?
Yes. Okay. We do get patients in their 20s, and it has improved in the last few years because lately I do have patients who are either triggered by having a family member who has had breast cancer diagnosed at an early age, less than 30. So they come in earlier and get their screening done, etc., investigated. But I guess because I work in a private center, and if patients are covered by their employers, they do come for checks. They go to their panel GP and they may get referred. Although I must say that some patients find it difficulty to get referrals, but I do worry about the public system because it is congested, and especially more so in the last 1.5 years, where the major referral centers for breast cancer have reduced their clinic appointments because they are attending to COVID infected patients. So there has been delay. We have to create an avenue, and I do feel like what Panta is doing in this weekend is almost every year we do have seminars where we invite GPs, panel doctors to come and listen. And anyway, this Sunday is via a webinar where we increase the awareness and update the GPs, which I consider frontliners in terms of cancer, especially breast cancer, because it's so common, to inform them, update them that don't treat every breast lump in a young person as benign. If there is any suspicion, just send them for an ultrasound, which is non-invasive, is not harmful, is not painful. Get an ultrasound done, and then we can move on with the process. If it is suspicious, the patient can get the investigations done. So to reduce that threshold of referring and being more aware that just because somebody is 20-something, it doesn't mean that they don't have breast cancer. And just to relate, this was many years ago, one of my relatives, a second cousin, she was 38 at that time, and she was from Kedah, lives in a small town. She felt the breast lump. She was breastfeeding her youngest child, who was about a year old. And she was just told, oh, don't worry, it's a fibroadenoma. She was not sent for an ultrasound. A fibroadenoma is a common benign breast lump, it's not dangerous. She was told it was a fibroadenoma. She was not referred for an ultrasound. She was not, the GP did not have an ultrasound machine, but not referred and not given a follow-up to say that, okay, I will see you in 2 months or something like that, and if it changes. Now that went on for about 3 months later. She went to the Alostar government hospital, and she was diagnosed with breast cancer, advanced stage, because it was an aggressive tumor, because she was 38, and all because she was not picked up early. So just because somebody is breastfeeding or very young, it doesn't mean they cannot get breast cancer. So there needs to be more awareness, I believe, among the healthcare providers as well, not only the public. Lower your threshold of referral. Don't ever think that anybody is going to laugh at you for, being referred for just a breast lump, or it's just a breast lump. So because this is where we can improve on pickup and earlier detection, because it is not preventable. Breast cancer is not preventable. We can treat it early and cure it if it's early enough, and it doesn't, we prevent it from recurring, but there is no 100% proof way of preventing it. Even those who have preventative mastectomies, they are always told there is always that little risk, because there's nothing 100%, right, Saunthari? No 100% in life, even if you have bilateral total mastectomy. So exactly. We just have to, be aware that, just need to go for a check.
So you would, sorry, please carry
on.
No,
just very quickly. I think Azlina hit it on the nail by saying there's no 100%. Yeah. And despite everything and all the advances which you see in terms of treatment, etc., when it comes to breast cancer, the key point though is finding it early. If you don't find it early, it doesn't matter what fantastic treatments are out there, your chances diminish quite a lot in terms of being cured of breast cancer. So finding it early is the absolute key when it comes to breast cancer.
Okay, got it. I'm sure it's on the minds of a lot of our audience out there. So what you're saying, 20-something, when you talk about 20-something, are you talking about early 20s, late 20s? When should they start checking, and where should they go, and how should they start? Because I think that's the perception people get. If I don't feel anything, then I don't need to check lah, So how does it all begin?
Okay, so every country has a little bit of differences in terms of what their guidelines are in terms of what you do for breast cancer. But everybody does agree that young women should be aware of their breasts. Okay, we're not talking about breast cancer. We're just talking about being aware of their breasts. So once you're around 18 years old, 19, 20, 21 and stuff like that, start thinking about your breast and your breast health. So what does being aware of your breast mean is that understand how your breast changes throughout the month. Before your menses, your breast might swell up. You might feel a little bit of pain in your breast. After your menses, they become soft again. So feel your breasts during your menses, after your menses, etc., so that you have a gauge of, okay, this is how my breast feels at any one time. So you understand what is the normal for you, because the normal is different for everyone. Some people have lumpy breasts, you know. A lot of Asian women, because they're small size, they're petite, they have dense breasts, which means their breasts are a lot firmer compared to someone who's like me, who's a little bit more big-breasted and, you know, has a bit more fat in my breast. So it's actually easier to feel my breast compared to someone who's more petite.
Right.
Maybe like yourself. You know, so everyone is different in that sense. And the younger you are in terms of understanding what your breast is like, the faster then you can pick up when you feel something wrong with your breast. So once you understand your breast, then we say, you know, every month, every so often, just feel your breast, so that, you know, you feel that, okay, it's normal. And if you detect that something is not right or not the same, that's when you go and see someone. So before the age of 40, there's no such thing as, oh, you know, every 3 years you have to go and see a doctor to get an ultrasound to check your breast and stuff. You know, there's nothing really like that. For younger people, it's really you yourself using God-given hands that you have to feel your breast and be aware of them. If you do feel something, then as Dr. Azlina said, go and get an ultrasound. You know, make sure what you do feel is normal, or it could be a benign lump. So it could be something which is not cancer, which is also very common in young women.
Okay.
Having a fibroadenoma or having a cyst, etc., is very common. But knowing what you have is also very important.
Right. Okay. Understand. So at least we've put that in perspective now. Now, you know, a lot of people will probably be saying, a lot of ladies, you know, will be talking about the cost of it. It's going to cost too much to go and get yourself, you know, tested or do an ultrasound. Is that the case, or what's that perception like?
Okay. Yes, you know, there is a cost to any test that you do. However, having said that, there are avenues that you can take to get tested in places which don't cost you. So under the Ministry of Women's, they actually have a program to do breast screening. So you can actually, you know, go through the ministry. So if you go to any of the clinics, the Ministry of Women clinics, you can actually go and say that, you know, you feel something, etc., and they can forward you to actually get tests done. And that doesn't cost you anything. The National Cancer Society of Malaysia has free screening for the underprivileged. Okay, and that's nationwide. So, you know, so if you feel that there's something wrong, call us, you know, get in contact with us, and we'll try to arrange something for you. So there's a lot of avenues out there. So I don't think the cost of it should be the consideration when it comes to your breast health.
Yeah, absolutely.
Yes.
Dr.
All the clinic kesihatan, like what Dr. Saunthari mentioned, you know, they can go to clinic kesihatan, and in Malaysia, it's one of the best in Southeast Asia. Probably almost one every mile. Okay, that shows my age. Every mile, you have a clinic kesihatan. Okay, one every 1.6 kilometers or so, there will be a clinic kesihatan that you can go and seek help and say, okay, you know, I found something, or something's different, and they will refer you. Our healthcare system is really, really good. So I don't think that should be an excuse. I feel that the majority of women don't go because they have this fear. They say, takut lah, doctor.
Yeah.
I said, okay, siapa tak takut? Siapa tak takut, you know, having to face reality that there's something changing in your body. But what if you, you know, deal with that fear so that you can get comforted by the fact that what you're feeling is not dangerous. So it could go either way. But if you miss out on that opportunity and you wait for whatever it is in your breast or in your body to fester, you might have lost that opportunity. So we need to drum this into the public. Just go to the nearest place. It's up to you. Everybody's different. If you're covered by your company, or if you have insurance, or etc. And there are many screening centers all over the world, all over Malaysia, where they can deal with your problem. So it shouldn't be an excuse. See, when people say it's expensive, and then when I look at what they wear, and I wonder, okay, you can wear all these expensive attire and shoes and glasses and all sorts of things, but we really need to pay more attention to our health and maybe prevent something catastrophic from happening.
Okay, so we know that there are these clinic kesehatans that they can go to, and a lot of free clinics that they can go to without incurring any expenses, just to have a check. I think that is, yes. I think that's the basis of it. In your early 20s. Dato Hazima, you deal with a lot of women. Do you think women nowadays, they are still they still lack in the awareness of breast cancer and what it can do to you?
Thank you, Elaine. I think what's happening out there, I believe they are too shy, and I believe that they are too scared to face reality. It's more like they know they have a situation, but they are too embarrassed to share, or too embarrassed to even share it with their own family. So yeah. I have a friend who is also breast cancer, but she was such traumatized by it. She was so traumatized by it, and she came to me and talked to me when the thing has already been like all over. So I follow her to the hospital, and I gave her some moral support, but it's too late. So that's why, like what both doctors are saying earlier, the early detection is very important, Elaine. So don't be embarrassed. To me, you have to do the mammogram. I did it every once a year, actually, during my medical checkup. So okay. Don't be afraid. You have to face reality. We have an issue here, so we have to overcome the issue. Don't sleep over it. The more you wait, the worse it's going to get. Yeah.
Absolutely. Thank you for that. Doctor, so once a patient is diagnosed with having breast cancer, what happens then? Dr. Saunthari, maybe, or Dr. Azlina, whoever.
Well, I'm going to hand it very quickly to Azlina. Once a patient is diagnosed with breast cancer, the first person they usually tend to see is the breast surgeon. And from that point onwards, then the type of treatment is worked out depending on what the investigations have shown. But what I'd like to interject here before I pass on to Azlina is that once you're diagnosed with breast cancer, don't ever think that you're alone. There is always help around you. So don't just think about the physical aspects of the breast cancer, the disease aspects about the breast cancer, but think of it on a bigger picture of the psychosocial aspects, the financial aspects, all those aspects there. And there are organizations such as the National Cancer Society, Breast Cancer Welfare Association. There are many organizations around who can support you through this journey. So what I'm trying to say is just don't think of the clinical aspects of it, but look at it in totality. And now I'll pass it as a whole, because it affects you personally, just not your body. It affects you personally, exactly.
The works, right?
Yeah. But the clinical aspect, Azlina will.
Dr. Azlina?
Yes, I need to inform our listeners and viewers that in Malaysia, we only have on the National Specialist Register 59 currently, 59 breast and endocrine surgeons, but the majority of the work in the whole of Malaysia is actually managed by general surgeons. So how breast and endocrine surgeons train is that we train in general surgery first, and then we subspecialize into breast surgery. So depending on which state you are, you will present either to the general surgeon or to the breast surgeon. Now, once you feel that we are talking about once it's already diagnosed,
Yes.
the patient has been diagnosed with breast cancer.
Yes.
Usually what involves the diagnosis is we have to stage the cancer. Yeah. So we have to look at the size of the cancer. Has it spread elsewhere? The subtyping of the cancer, that's that second part of the test, the biopsy. Okay, biopsy is taking a little bit of sample from the mass or the lump itself, sending it to the pathology lab, and we confirm. Sometimes the biopsy is initially done confirming the cancer. However, the subtyping is not known. So then we have to proceed with the subtyping, because not all breast cancers are treated in the same way. So we have the slow growing types or the not so aggressive types, and we do have the aggressive types. Now, depending on the size of the cancer, the early stages of the breast cancer and those that are not so of an aggressive type, we can do primary treatment, which is surgery. So we will do plan for breast conserving surgery. And sometimes, depending on the age, now we have this technology called intraoperative radiotherapy, where if it's a certain type of breast cancer and early, we can give immediate radiotherapy treatment whilst the patient is having the surgery done. That means taking out the cancer, we can give radiotherapy, and that replaces the need for coming for radiotherapy after the surgery. But this is for early breast cancers and certain types of breast cancer. Usually the hormonal positive breast cancer, which is not so aggressive. Whereas there is other women where we can do breast conserving surgery, meaning we don't need to remove the whole breast, and sometimes the patient needs further radiotherapy as well. So treatment for breast cancer not only involves surgery. Some patients need radiotherapy, some patients need chemotherapy. Chemotherapy is giving medications via injections, where the drug travels throughout the body to kill off the cancer cells that have traveled throughout the body. And there's also treatment called targeted therapy for certain types of breast cancer. Usually the type of the cancer is only about 20 to 25% of all the cancers. So these are usually the HER2 positive breast cancers. Doesn't occur in everybody, only about a quarter. And then there is also coming into play what we call immunotherapy. A lot more studies are coming up. Many forms of treatment for different types of cancer. So usually when we look at the biopsy results, the breast surgeon or the general surgeon would have already planned the path of what needs to be done first. And usually what I advise patients when I see them is, you see, that first visit after the biopsy is usually quite traumatic. And I always make sure that they come with somebody.
Yeah.
Doesn't matter who they want to come along with, because always having another pair of ears is better for the moral support. And also sometimes when you just say the word or the statement, "I'm so sorry, Puan," or "I'm so sorry, madam, it's confirmed to be cancer," pop, everything. They can't hear anything else. Okay. So if the doctor, yes. So I always write down on the blank sheet of paper what we are dealing with, what we need to do, and at the end of the or in between, I welcome questions. And if they attend to the questions, and I never make them sign at that moment on that same day. I can, what the patient needs to do is take a couple of days or so to figure out what they would agree on, because if they come early enough in the breast cancer diagnosis, there are many options. However, if the patient comes in late stage, usually time is of the essence, but I try not to rush them, because that is the critical moment where it needs to sink in. So a lot of times patients need some time to figure out, and they always need to plan what they need to do in the next few days. If they have children, they are working, they need to plan the time so that when they come in, they get admitted. I don't want them to be thinking, oh, who's going to cook? Who's going to wash the clothes? Who's going to take over my job? So we need to plan this properly so that it becomes as smooth as possible. Of course, things are they are traumatized, and there'll be tears. We will do initial counseling, but this is the time not to push them into making a decision. And unfortunately, sometimes some patients are so scared that they disappear after that session, or I call it is breaking bad news session, the BBN session. Sometimes if we don't deal with it in the ideal manner, of course, trying to be idealistic here, there's no ideal situation, but if we don't give them that time for that realization to sink in, they are going to disappear, and they are going to go for alternative therapy, where they are always promised, oh, you don't need to have any operation, you don't have to take any medication, we can give you some herbs or something, it will disappear. So we need to try and get a buy-in. This is what I always say, it's a buy-in. I'm trying to sell an idea to them to prevent further damage to their body. But if we don't get that buy-in, you are going to lose them. So this discussion is very important, and I feel that it shouldn't be rushed. Even delaying surgery for a week, it's not going to matter, except in very aggressive cancers.
Right.
And that is rare. It's rare. The most aggressive cancer is the inflammatory type, and thank God it's rare. There are, of course, situations where the patients come in when the tumor is bleeding or it's infected. We call it fungating breast cancer, where it's like a fungus. So sometimes in these situations, the patients need to be admitted straight away. So what we do depends on how they present themselves.
How severe it is, right?
Exactly. So we have to look at each situation. If they come in, they've been bleeding for a while. Sometimes it's a slow oozing from a huge cancer. And when they come in, they could be totally as white as sheet. So that's like a semi-emergency. They might need transfusion, etc. We still see cases like this, and sometimes it's not for want of knowledge. It is always the number one thing, the fear. So they keep it until they feel pain. And this is another thing I need to remind the audience, that it doesn't mean that it needs to be that you have to feel pain to be diagnosed with breast cancer. Breast cancer commonly is not painful. So this is the myth. Say, but I don't feel any pain, doctor. How can it be cancer? And I hear this day in, day out, but I didn't feel anything, doctor. Well, it commonly does not produce much pain. So the women who have pain and come to breast clinics usually have cysts or some hormonal issues. So it might be so, or their diet consists of things that increase water retention and makes their premenstrual symptoms worse. So sometimes they come in, commonly they come in with pain, but unlikely most of the time.
So most of the time they come in feeling a lump in their breast, is it?
Yes. And occasionally, of course, with increase in screening, they are detected via screening. They probably go because they have the executive screening test done annually, and the tumor is picked up on screening mammograms or ultrasound. Of course, the pickup is not that high. I do know people say, screening is not effective. Okay, there are two ways to look at this. We have to, number one, teach women to be more aware of their breasts. And if they see changes is the most important word. If we don't teach them how to know their breasts, they will not realize the change. So we need to teach breast self-examination. Okay, next is, apart from that, we know that the commonest age group in Malaysia is between 40 to 55. But of course, we get the outliers on the bell curve.
Yeah.
We do get outliers, those below 30 and those above 65 or 70. So the commonest age group is that age where most, if the women are still working, they would fall under the executive screening privileges. So we do get picked up that way. So there's no ideal way really, but apart from teaching women to be aware of the breast and the screening, we have to reach out to the rest out there who fall out of this, population, to be more aware and get themselves to the healthcare centers to be investigated.
Okay, thank you. Thank you for that. We're talking about families and how, you get your family intervention coming in to support these ladies. Dato Hafsa, I think you're here. You're not on my screen, but I think you're here, the chairman of WLF. Do you think families play a very important role in, helping these ladies come forward to realize that they need to seek treatment, that they need to do something about it?
Oh, thank you, Elaine. Yeah, definitely. I think families, friends, support group, they play a very important role in helping the cancer patients to overcome their stress and the trauma that they found that they are being infected with cancer. And I myself have been providing support to some of my batchmates in school, and we lost them. We lost about 2 of them. But we really, I think that's where you really put it very, very nicely. Not just family, but friends and the whole entire big family really need to give the support to this if someone is being diagnosed with cancer. And believe you me, I think for us, when we gave our support to our batchmates back then, we never want her to give up hope, really right to the very end, Every little support that we can give, be it in terms of emotional support, be it in terms of financial support, any form of support really would help. And more so if you're a close family. And I would imagine that the closer you are to the cancer patient, the more that we need to give the support, emotional support in particular, because the one that is having cancer is so very weak. And I mean, for me, if I'm stricken with cancer, I really don't know what I'm going to do. The first thing that comes to my mind is that I'm going to die. Right? I'm going to die. And what next? Do I submit myself totally to the Almighty, or do I actually don't give up hope and try to fight? So that's where all this cancer support would come in very, very useful. And as I said, that it cuts across all aspects, in even your workplace. And I believe that by having this cancer support, it will help us to push us to give a new hope of life and to be able to provide a meaning to the whole entire survival mode of the person who is cancer stricken. And that's my thoughts. Thank you.
I mean, we talk about, the cultural aspect of it, and, whether marriages will break down. I think women are just so conflicted, when it comes to things like this, that that they don't seek help, they don't seek attention. What are your thoughts on that?
Well, I must say, after listening to some of the conversations here this afternoon, some of them, the first thing that comes to their mind, they are scared. Number 2, they are embarrassed, right? So I think this is one thing that we need to take it off, especially the second part of it. Yes, everyone will be scared. Not to mention if you are diagnosed with cancer, you're diagnosed with diabetes, we'll be very scared. The first thing, as I said, I'm going to die. But the second part is, how do you overcome that embarrassment, especially is something that is important to women. Why are we born women to have this cancer? I mean, I heard what Dato Somasundaram said. The only problem is this is only apparent to women. The men do not have this cancer of the breast, right? So we've got this particular organ that's given to us, and we've got to look after it, take care of it. And I do hear loud and clear what Dr. Sunandri mentioned. It's nothing to do with food, nothing to do with exercise. It's all because of we are women, all right? And that's real. And there's a lot of what you call it. If I were to put it in a very simple context, when we are being diagnosed with cancer, the first thing that comes to our mind is that, why are we born with one? Why me? Why me? Why am I born a woman? Why do I have this with me? All right. And it goes into a lot of psychological issues that comes on board, and this is where I think the conversation this afternoon is, how do our husband, our spouse, our brothers and sisters help us to overcome this psychological mental stress that we are in it, and that's where that support really comes in. And I do hear what Dr. Azlina did mention again. She was saying that, even if you go to work, people then tend to look at you like, okay, you're breastless, you don't have a breast, blah, blah, blah. Some episodes that I want to share with you, some episodes that they have put those silicone breasts, Dr. Azlina, and we were having our Solat Asar one day. My batchmates again, trying to help our cancer patient. And they put this silicone breast, and little did we realize, and then I saw something falling, something soft and rolling. So I said that, wow, what was that? And so that's my breast, and it became the joke of the afternoon. And we took it so lightly, and the cancer patient with that breast, that silicone breast, was having fun among all of us, So and she's not embarrassed after that. So that's something that I think we really need to look out for and see how we can change a situation into, not to say fun, but not to get it out from being so stressful from that cancer patient, and help her to overcome it from this whole embarrassment part of it. Yeah.
Well said. Thank you very much. We've got some.
Can I say something, Elaine?
Yeah, go ahead.
Men do get breast cancer, but much less. 1 to 2% of men do get breast cancer, and if you have a father who had breast cancer, you are at actually very high risk. So men do actually get breast cancer, and they're treated in a similar manner. And yes, men do get breast cancer. Men can support. I just answered one question just now that was posted. How can men help in the journey of breast cancer? You can be there, accompany them for appointments, for procedures, for admissions. You don't have to say much. You don't have to put blame. Just be there and be supportive, because women need that. The thought that you are there with them throughout their journey means a lot. It doesn't have to be in so many words. It's just being there. Okay. And yes, with the prosthesis you said that fell out when the lady was, during Solat and all that. That also reminds me of a story of a lady many years ago when I was still in under Kementerian Kesihatan. This lady, we had advised her, you can have reconstructive surgery. She had mastectomy, and we said to her, would you like to have delayed reconstruction? That means putting in an implant or taking some parts of her body. You see, these days we can do reconstruction, either breast surgeons working together with plastic surgeons, or those trained breast surgeons trained in oncoplastic surgery. That means you do some sort of plastic surgery where they can do immediate surgery or delayed surgery. This lady had a mastectomy and said, we can have delayed reconstruction. We can take your tummy wall to create a breast, or we can put in implants and all sorts of things, many ways. And she kept refusing until one day she came back to me and she said, Doctor, I think I need it now. What do you need? Doctor, I must tell you, please, doctor, please don't laugh. Now this lady, she plays badminton quite frequently. So she said, one day I was serving and it fell out. And 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 she said that brought her. Now I need it. I don't care. Dr. Azlina, please book me for surgery. I can't stand the embarrassment. I walked out of the badminton court picking up my prosthesis. So, you know, so yes, we can do all that reconstructive surgery if the woman is agreeable. We can do that. That's all part of the discussion if the patients come early. Now, immediate reconstruction is occasionally not possible when it has affected the skin, etc. But we can always discuss delayed reconstruction, maybe in 1 or 2 years later, when further treatment to the breast and chest wall has been completed. So there are many options now available. We are very lucky. We live in an age where the thing with breast cancer is that because it is common, there's a lot of research on it. There is a lot of updates on it. How we practice treating breast cancer is a whole lot different compared to even 10 years ago. So when I get patients, you know, doctor, I have a relative with breast cancer and she had a very bad experience with chemotherapy, etc., etc. So I let her talk. Then I ask her, how long ago did your relative get treated with breast cancer? 15 years ago. So I tell her that doesn't apply anymore. You know, I can get you in touch with recently diagnosed breast cancer patients who will tell you that it is tolerable. I've even had patients 60-somethings, 70-somethings who had chemotherapy and sailed through it. So they will look at me like, doctor, you're lying. But see, no, then you can hook you up with some survivors and let them tell you their experience. So this is where we get survivors from Breast Cancer Welfare Association or National Cancer Society to hook up with the patients to give their part of it. Because of course, they might not believe, yeah, you know, the doctor is just saying this, you know, because she wants me to be treated.
Yeah.
Then you hear it from the horse's mouth. Okay, I'll hook you up. You can have a chit chat or a tea or a phone call or something. Then you can get back to me and see whether you would like to continue with treatment. So this is where we get society involved. We get the NGOs involved, and believe you me, over the years where I work, we always get the assistance of breast cancer survivors who have had training in counseling to assist our breast cancer patients through their journey. And a lot of them have remained friends, and they are we can't do without them, you know. So it's, I mean, it's a good time. And I always tell patients, if the thing about breast cancer, there are many options, and really, if you need to choose, if you're unlucky enough to get a cancer, it's breast cancer. Because there are many options. Yep, Saunthari, agreed?
Yeah, I mean, Azlina spoke about, you know, one thing Azlina is wonderful at is that she spends so much time with the patients. She spends so much time explaining things to people so that they have that confidence of moving forward. Not everybody does. Especially if you're in the public health sector, etc., where, you know, there are a little bit of pressures in terms of time and stuff like that. So not everyone might get that similar explanation about their breast cancer and have that similar confidence in terms of what are the next steps or the treatment options out there. And as Azlina said, you know, that's why the community is so important. Yeah. One is that there are specialized people out there within the breast cancer support groups. There's organizations such like ourselves and you know, BCWA, etc., who also have medical people such as myself, who can sit down and counsel you on the medical aspects of it. So what your doctor couldn't explain, we can explain, so that you can go back to your doctor and talk to your doctor about it. You know, we don't make treatment decisions for you, etc., but we help you understand it and empower you in terms of understanding your own cancer, and you know, give you a perspective in terms of what you want out of your treatment. Because we're no longer now talking about, oh, you know, we just treat the cancer. The doctor will tell you have to do A, B, C, and D. It's now more the question of what do you want in terms of treating this cancer and your overall lifestyle. You know, what is important to you in your life when we address this cancer?
Yeah.
And so it's a totally different perspective. It's a totally different way of looking at a lump in your breast. And yes, it's very dependent in terms of when that cancer is diagnosed. If it's, you know, diagnosed in a very early stage, and you've got a whole life in front of you, including fertility, having your children, etc., you know, that's a lot of things to look at in terms of the treatment of your cancer, compared to someone who might be 70 or 80 years old, who has a similar cancer. But then, you know, the end results or the end consequences of that cancer or your needs from that cancer, you know, are totally different. So it is looking at that person, and that's where having that community support is so incredibly important. And as Dato Hazima mentioned as well, is having the support of the people around you. I am a big advocate for support, you know, for support from everyone. But one thing I always caution is that support in the ways that you can, and don't widen the scope into areas that you have no knowledge of. Because we have friends who mean the best to us, you know, who want to do the most, you know, they want to help. But sometimes that help comes in the manner of advising on, or this treatment, or someone had something else in terms of their treatment. Why is your treatment this way when that person did something else, you know? And it adds so many doubts to the patient and to the family in terms of whether the treatment that they're taking or the path that they've decided to take is the right path. Okay, so that is the only thing I really caution on in terms of support. Support where you are best, where your best expertise is in terms of your support. If you're the husband, you are there to be with your wife through thick and thin, whether she's screaming at you for no other reason other than that you're there, or you know, or she's sobbing on your shoulder. You know, you make sure your shoulder is there for her to sob on. Or a friend who's there to help you with the cooking, who's there to help you with, you know, taking your kids to school, or, you know, making sure that they have things to do whilst you're in hospital, etc. Do it to your expertise, and don't look beyond that in that sense.
Okay, thank you for that. We do have some questions here from our audience. Now, what is the survival rate of those who are less than 40 years old? Doctors?
I think in terms of survival rates, you really have to look at the stage of the cancer. There's no one figure to say, oh, yes, you know, if you're under the age of 40, your survival rate is going to be 8% or 60%, etc., etc. When you look at survival rate, you're looking at the type of cancer that you have. Now, unfortunately, in Malaysia, our survival rates are not that high compared to similarly developed countries.
Okay.
So if you're looking at Singapore, you know, Singapore's survival rate for breast cancer might be in the 80s. Malaysia's breast cancer survival rate is in the 60s. And it's not because Singapore has incredibly good treatment compared to Malaysia. It is based on the stage of when that cancer is diagnosed at. And unfortunately, as you know, what we've been talking about is most of the cancers in Malaysia are late stages. So we are looking at 48% of breast cancers in stage 3 and stage 4. So that's going to drop your survival rate straight away. Okay, so I cannot give you a figure in terms of what the survival rate is for those less than 40. And it's also because we don't have those figures available for us in Malaysia as well.
Okay. Now this is another question also by Michelle CBN. How can our individual thoughts change our survival once diagnosed? I think what she means is, you know, how do we remain positive, and how do we, champion ourselves to fight this once diagnosed? Besides
Yeah.
the support?
Yeah, here I think that the most important thing in terms of how do you change your survival rate is empowering yourselves. Don't be labeled, or don't identify yourself as the person with breast cancer. You know, breast cancer should not be that identity you take. You should look at yourself as, I am a person who has, yes, a disease, which is treatable. But how do I treat that is to ensure that I know everything there is to know about that disease and the treatment options there, and being able to have the voice to be part of the decision-making of my disease. And I think that is incredibly important, that it's not a one-sided conversation with your doctor, where the doctor is telling you, you do this, 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 and this, and this, and this. But it is a collaboration. It's a two-way dialogue, or a 3 or 4-way dialogue, depending on who your support groups are, etc., etc. In terms of looking at that, okay, this is what's happened to you. These are the options available for you for certain outcomes, and are these the outcomes that you want from your diagnosis? And are these things important to you? How can we help you achieve that which is important to you? And if you have those sort of conversations with your doctors, then you have confidence in your treatment. And if you have confidence in your treatment, you will do the best for yourself to achieve those outcomes. So you will look after yourself. You will ensure that you eat properly, that you do the exercises you're supposed to, you go for the follow-ups you're supposed to, etc., etc. Because you feel empowered enough to be in charge of your own body.
Okay, got it. Do employers in Malaysia provide enough well-being support for employees who have been diagnosed with potentially long-term health issues? Who would like to answer this?
Okay, if I just say very quickly there then that I think if you work in the public sector, if you're in a government employee, in terms of time off, in terms of support, in terms of the medical support, etc., they've got very good plans out there. You are well supported. You're giving the time off, etc., to go through your treatments. And if you want longer time, they do allow you to do things like that. So I think in the public sector, it's not bad. In the private sector, Azlina would know a lot about this as well. It really depends on the company.
Yes.
Whether you're in a Malaysian company, whether you're in a multinational company, all those things play part in the HR.
And insurance covers breast cancer, does it?
Yes, insurance covers breast cancer, but this is the important bit. Nowadays, I tend to ask patients, how long ago did you get this cover? How long ago did you buy this insurance? So sometimes some patients don't understand about the cooling off period. They can't be diagnosed, so soon from the time they purchase the policy. Okay. So that is quite important. And of course, if there might be some issues, sometimes there are queries prior to their treatment. They've had lumps before, but then they would query whether this lump was benign before, how long was this lump present before it was confirmed. But usually those with breast cancer diagnosis, most of the time we don't have an issue. It's just that occasionally, I wouldn't say occasionally, a lot of times when patients have to be on oral medication. Now, if they are admitted, when they need chemotherapy, any injection therapy, patients tend to be admitted for day care. So that's counted as admission. Now, with medication that the breast cancer patients require, for example, the hormonal treatment, the oral hormonal treatments for 5 to 10 years, occasionally it's not covered by the insurance or the employer. So that's the issue, where they think that we have to explain to the employers that it's not a supplement, it's a medication and the patient requires it. So a lot of times there's a lot of letters bouncing back and forth trying to help the patient to get the coverage. Also for in the public side, as far as I know, if the patients are under, they work for the government, they're under JPA or the PSD, the Public Services Department, they do get a minimum of 1 year full pay leave. Okay. So they can concentrate on their treatment, and if the patient requires further time to continue with the treatment, they can extend it to up to 2 years. Of course, they don't get all the allowances, but they do get full pay leave. And unfortunately, sometimes I've had patients where they feel that they are forced to quit their jobs because they feel as if they've been a burden to their colleagues in the department, and sometimes they've been told, you know, why don't you just, you know, take so etc. You know, that and sign themselves out of the job market. So I find that very sad, because if they have had treatment for breast cancer, they are okay to work, especially the early breast cancers.
Yes.
So I am not sure though about if patients do need referrals to psychologists or psychiatrists as part of their treatment, and I'm not sure whether it would be covered by their employers. So that's the part I'm not too sure. Maybe some of our ladies here can contribute a bit to what experiences that you know, your company provides, the facilities or you know, the benefits that are given to cancer patients.
Anyone else?
Anyone would like to? Ruzi, would you like to maybe just volunteer some information?
Yes, yes, at CGS CIMB, we do cover for the treatment of the patient, but within certain limits. And also we do give sabbatical for them. So yeah, it's part of our package, part of our employee benefit.
Okay.
Yeah.
It's good to know. Yeah.
We have a question here. What should very young ladies know about their way of life so as to reduce the risk of getting cancer besides the preventive measures?
Okay. Reducing risk is prevention, basically. I think it's the same thing that we're talking about here. And when we talk about breast cancer, as well as all the other cancers, this is the only thing which is different with breast cancer and all the other cancers is that breast cancer is something which happens in women because you're female.
Yeah.
But when you look at risk in terms of cancers, including breast cancer, the ones that we know play a big part in the cancers is our lifestyle. So we do know that, as I mentioned, the trifecta before, which is obesity, inactivity, so not having enough physical activity, and eating a lot of fatty foods. Those three things across board, all cancers, including breast cancer, is a major factor. Okay, so this might not affect you when you're young, meaning that it might not be an issue of getting breast cancer at a young age because you've had these unhealthy lifestyles, but it will impact you later on in life. So when you're in your 40s, in your 50s, etc., when the genetic aspects of your breast cancer doesn't play a huge part in it, these issues play a bigger part in it. But it takes 20 years for a cancer to evolve. So what you do in your 20s is going to impact what happens to you in your 40s.
Ah.
And so that's why it's so important in your, in your teenagers, in your 20s, etc., to gather that lifestyle, to be mindful about your lifestyle at that time. So with breast cancer, we're talking about obesity. And obesity is something which is a little bit more complex, meaning that, you can be very thin now, but if you're at menopause and you suddenly put on a lot of weight, that increases your chance for breast cancer much higher compared to if you were overweight throughout your whole life. So there's a bit of complexity when it comes to obesity, but just talking about obesity by itself, it is a risk for breast cancer. Being inactive. So you can be skinny as anything. Okay, you can be really, really skinny, eating well, but if you're inactive, if you're not doing the exercise that you should be doing, that also increases your risk for breast cancer. So it's not like, oh, you have to be obese and, a couch potato and eating chips all the time, etc., and then only you get breast cancer. It's one or two or three of them in the different combinations. Yeah. And we always talk about a balanced diet. And a balanced diet is, we all know what a balanced diet is. But when it comes to breast cancer, it is, we know that processed meat, eating a lot of processed meat, eating a lot of fatty meat, and alcohol makes a difference specifically to breast cancer.
Oh,
okay.
Interesting. So healthy diet, exercise, and get off the couch, right?
And I think COVID's made that quite difficult for some of us.
Do that in their 20s so that you don't suffer the consequences in your 40s.
Yep.
Okay. Well, unfortunately, we're running out of time, but we'd like to hear from, we've answered a couple of questions from our audience on Facebook as well as here on Zoom. We'd like to hear any last words from our doctors. Dato Hafsa, would you like to say anything before we leave?
Well, I think we have had a very good afternoon of good conversations, not only knowing about how do we detect initial stages of cancer, but also how do we overcome it, and also support, as well as awareness programs that could, needs to be cascaded down to the younger generation. I would imagine that this work done by CIMB CGS and also the Women Leadership Foundation should be not confined to just this group of 46 today, but it should be a national program. And I think we'll be able to provide better information, better awareness to the whole entire country of what to look for, what are the signs to look for, and how can we get support and create better awareness. So definitely, I think very good conversation this afternoon. Congratulations to Ruzi and the team. And also thank you so very much to Dato Dr. Saunthari and also Dr. Azlina. I learned a lot this afternoon. Thank you so much.
Thank you. And Dato Hazimah, would you like to say anything?
Yeah, I would think that, my God, I learned a lot. I agree with Dato Hafsa. I know more about breast cancer and what we should do. I must leave my couch and go and exercise. So yeah, I did that. I have a treadmill at home, but sometimes yes, sometimes no, sakit lutut and everything, decided not to, all sort of excuses. So now no more excuses. Yes, we are all in the midst of getting old and menopausing and all those things. We need to get ourselves out there and be active and yeah, take care of our health. What else can we do? Yeah, I have a sister who is a cancer patient now, going through chemotherapy. But it's so sad to see her, and she was very my God, I'm so proud of her. She's very strong, but she went for 2 courses of chemo, and only last Monday she went and she did an ultrasound and a scan, CT scan. They found a new growth in her liver now, but not breast. Started off with with colon cancer spread to the lungs and spread to the liver. I'm so sad, but listening to all this, and I've lost some good friends as well, like Dato Afsa mentioned, to breast cancer, and I feel that there's a lot more breast cancer awareness that we need to show out there to the people, for the ladies to come out. And I am very willing, Dr. Saunthari, under the WLF charity pillar. I'm the head of the charity pillar. I would love to work with you. How can we work together to create more awareness, on this support, and what else can we do? I think my sister is in this Cancer Society as well. She's online.
Oh, wonderful.
Yeah. She's so strong, and I believe that, she's living her life normally without having any effect. And after the chemo, she was like happy, and I was like, hey, hello. Everybody told me that people with after chemotherapy will have some side effect. Yeah, I have some burning here, burning there, but I'm okay. She's always saying she's okay. So a wonderful sister of mine. I love her very much, and I feel that all of us should work hand in hand. And thank you very much to Puan Ruzi for putting us together in this WLF, together with CGS CIMB, to organize this wonderful insight, which is very, very important to all of us. And I really hope, I really wish love and peace to all of you out there who's having this issue, and we are always there to give our ears to listen to all your problems. Sometimes you need to let it out, to talk to someone. It's a very good therapy as well. And Dr. Azlina, I'm going to search for you in Pantai Medical Center. I'm going to go and do my test every year with you and check it out, what's going on. It's best for us to face it. Don't run away from problem. We have to face the issue here. Thank you so much, Elaine. Thank
you, Dato Hazima. Very inspiring and very thoughtful of you. What about our doctors? Do you have any last words to say to our audience out there, Dr. Azlina?
I would like to say a big thank you for Rosie for approaching me. Shall I tell her how we hooked up, Rosie? Okay. Rosie's auntie is my patient, and Rosie's auntie also is a survivor, and prior to that, she was involved in an NGO helping a lot of cancer patients, and most of them were breast cancer survivors. And when she herself was diagnosed, she knew what to do, and thank God for her. So I think 2-3 years ago, Rosie and I met at one of gathering, because Rosie's aunt is my husband's neighbor, a childhood neighbor. Wow. So they were, as children, they were popping in and out of each other's homes, those were the days. So anyhow, and thank you very much that she approached me, and we can do this because I think we can't do enough. We have to keep on talking about it until we turn blue in the face, because I get very depressed. I don't show it. I get very depressed if somebody comes in a late stage, where, especially in Klang Valley, because if we look at the National Specialist Register, there are 59 breast surgeons apart from the many general surgeons, and the majority are in Klang Valley. And if they don't come, I really feel we've done something wrong with the awareness. The majority of us are here. A lot, there are a few in Penang, in Ipoh, in Negeri Sembilan, Malacca, Johor, in Kelantan, Terengganu. Unfortunately, there are no breast surgeons in Pahang or Perlis or Kedah, but Perlis and Kedah, they can go to Penang. In Pahang, they tend to go to either Terengganu or to KL. Sabah, Sarawak, there's unfortunately only the capitals, Kuching and Kota Kinabalu, but we need to do more. Many years ago, I used to go almost annually to Sabah, to the small towns, collaboration with another company. But now they have more breast surgeons there, and I'm glad, but we really need to do more for our population, and I'm not saying it only for our women, for our men as well, because I think the men are hiding away if they have any breast lumps because they think it's a woman's problem. So we need to inform, I'm so sorry, but men also get them, although much rarer, but they do get them and they need treatment. So that's my last words on it. If you let me talk some more, we'll talk until tomorrow.
Thank you, Dr. Azlina. Terima kasih banyak-banyak. Dr. Saunthari.
Okay, I echo Azlina in the thanks that, you know, having this forum really, you know, increases the voices for breast cancer and the noise that we make for breast cancer. To all the women out there and all to the men who are listening as well. The one thing you know, if I can just say it again, reinforce this, is that early detection does save lives. You know, and early detection is not up to me or Azlina or anybody. It's up to you as an individual to do your breast examinations, to be aware of your breasts, you know, and be active about seeking out treatment or seeking out guidance. We at the National Cancer Society, as Dr. Hazima said, you know, we've got a wonderful support group here. We've got a wonderful group of people who are here to help you. So if there are any questions, and there's no such thing as a stupid question, okay? If there's any questions, you know, call us. We're just a phone call away. If you don't mind, I just share the number. It's 1-800 888-1000. So yeah, 1-800-888-1000. I keep forgetting phone numbers. You know, and you can call us about anything in terms of what you're scared of, because fear should not be the reason why you don't seek treatment. You know, and as Azlina said, especially in the Klang Valley, there's so many people around here who can help you. So there should not be any excuse for us or for Azlina seeing people in late stages of breast cancer. You know, there shouldn't be any excuse for that. Okay. Women, empower yourselves. You know, take that first step.
Thank you for that, Dr. Saunthari. Ruzi, over to you.
Well, thank you very much. We are very humble and grateful to have Dr. Azlina and Dr. Saunthari to share your personal journey and experience. It's been very engaging, enlightening, and, you know, awakening session. We can definitely do more and do our part in spreading the awareness, and continuously, you know, sharing awareness of early detection is very, very important for women to avoid this, or, you know, for them to face whatever challenges. So with that, I thank all the panelists, and also special thanks to Dato Hazima and Dr. Hafsa for joining us today. With that, yes, have a pleasant evening, everyone.
Thank you.
And thank you, Lynn, definitely.
Thank you, Rosie. Thanks for having me again. It's been such an enlightening afternoon. I mean, you know, we talked about spreading a very different kind of awareness, you know, something that, you know, we know now that we need to start when we're in our early 20s, and not wait too late, and get off that couch. Don't eat too many of those bags of chips, and work out. I'll see you on the treadmill, everyone. Thank you very much. Have a good evening.
Thank you.
Take care, everyone.
Take care. Bye.
Thank you.
Bye.
Bye-bye.
Bye.
Bye.